If you're on a fertility journey, chances are you've come across the acronym FSH. Well, in this explainer, we're going to break down exactly what that means for you and why it plays such a huge role in IVF.
All right, let's get into it. First, we'll cover what FSH even is. Then we'll talk about that fertility Goldilocks zone. Not too high, not too low. We'll see how FSH becomes the star of the show in IVF, help you decode your treatment protocol, and finally, put that number into perspective.
So first things first, let's get to the bottom of this three-letter hormone. What is it really, and why does it matter so much on your fertility journey?
I'm sure you've been there. You get your lab results back, you're scanning through them, and you see that FSH line. If you've ever found yourself wondering what it really means, well, you're in the right place. We are about to clear it all up for you.
Okay, so think of your brain as mission control. It sends out this really powerful little messenger, FSH, that travels all the way down to your ovaries and has one simple but super important job. Tell the follicles to start growing those eggs. It's basically the starting pistol for your entire cycle.
So now that we know what it is, what do the numbers actually mean? Let's dive into that Goldilocks zone. What happens when your FSH levels are too high, too low, or, you guessed it, just right?
These numbers tell a pretty fascinating story. High FSH is kind of like your brain having to turn up the volume. It's essentially shouting to get the ovaries to listen, which can happen when there are fewer eggs left. On the flip side, low FSH might mean that mission control isn't sending the signal out properly in the first place, which can lead to things like irregular ovulation.
Okay, but in the world of IVF, FSH isn't just a number on a lab report. Oh no. It steps right into the spotlight and becomes the absolute star player in the whole ovarian stimulation process.
So how in the world do we go from just one dominant egg to a whole bunch of them? Well, that's where synthetic FSH comes in. It gives your ovaries that extra boost, that extra encouragement to get multiple follicles growing all at the same time.
This whole process is so carefully controlled, it's pretty amazing. It all starts with a baseline check to make sure everything's good to go. Then you'll start those daily FSH injections to kind of override your natural cycle. Your clinic will be monitoring you super closely, and once those follicles hit the perfect size, you get a trigger shot to finalize maturation. Then, about 34 to 36 hours later, it's time for the egg retrieval.
You're probably going to hear a bunch of names like Gonal-F, Follistim, or Menopur. Don't let them confuse you. They're all just different brands of that same hormone medication designed to help those follicles grow. Some, like Menopur, even have a little bit of another hormone, LH, mixed in to help with maturation.
Now, this is really important. Your FSH level is not a grade. Think of it more like a guide. Let's look at how doctors use it to create an IVF plan that's made just for you.
This is where the magic of a personalized plan really comes into play. By using your specific hormone data, your doctor can create a strategy that turns your body's own information into a real advantage for your treatment.
So, depending on your unique profile, your doctor will pick the right approach. If your ovaries need a little more encouragement, a high-dose protocol might be the way to go. But if there's a risk of over-responding, like with PCOS, a gentler, low-dose or mini IVF protocol is a great option that focuses on quality over quantity. And the antagonist protocol, that's a super common and flexible option that helps prevent premature ovulation.
Okay, it's time. It is time to bust a really big myth. Your FSH level, it's an important clue, yes, but it is absolutely not the final word on your fertility. Please let this one really sink in. It is so incredibly important to remember. While a higher FSH level can mean there are some challenges ahead, it does not mean a successful pregnancy is off the table. It's a hurdle, for sure, but it is not a stop sign. Look, FSH is a key player, but it's part of a whole team. You've got AMH, which gives a really steady estimate of your egg supply. Then there's the antral follicle count, or AFC, which is like a live-action snapshot of your ovaries. You add an estradiol, your age, the LH to FSH ratio, and altogether they create this full, detailed map of your fertility.
What makes AMH such a rock-star partner to the FSH test is just how stable it is. See, FSH levels can go up and down from month to month, but AMH gives you a much more consistent and reliable look at your overall egg count.
And that is really the big takeaway here. This number isn't a final score, it's not a judgment, it's just information. It's a starting point, a guidepost that helps you and your medical team create a personalized journey, putting you right in the driver's seat.
Okay, so before we finish up, I just have to pop in with a quick reminder. All the information we talked about today is purely for educational and informational purposes. It is absolutely not a substitute for professional medical advice, so please always talk to your doctor.
And if you want to do a deeper dive into the entire in vitro fertilization process, you can find a ton of great resources over at ivfforme.com. That's ivfforme.com.
Ultimately, your FSH level is not a final verdict, not at all. It's the start of a really important conversation. Understanding it empowers you to ask all the right questions, and it transforms a simple number on a page into a powerful tool for your future.